youth development program. And the background of this is that, as you're aware of, the social mobility report suggests that one of the reasons, particularly in Muslim youths and the youth here, particularly in the Pakistani and Bangladeshi background, they lack in career progression. And one of the reasons they identify is that there is a lack of information for them to have a full informed choices and full informed decisions. It is lacking both in the students and as well as the parents. So this was the background. We thought that we will introduce this series of webinars on different fields of education. So the medicine and dentistry, we chosen the first, and subsequently almost weekly or fortnightly, we will be doing other webinars. Okay. So we are very thankful to Association of Pakistan Physicians of Northern Europe to work in collaboration with the 3MEM to help us in this cause, and we are very grateful for them. And it's a great pleasure and honor to welcome Dr. Amr Birni, who is the chairman of this Association of Pakistan Physicians and Northern Europe. He's a senior teacher in the university and academic lead for clinical skills. And he is also vice chair of Creative Minds Society. So I will also welcome his other team panels and the presenters, which are the students and doctors who will be presenting and helping us to reach this guidance to everybody, for the parents and for the youngsters to work, and it will guide them, and maybe that they will be more successful having this information. The format of this is that we will do the presentations first, and obviously we have 3 mentors. One is Dr. Amr Birni, then Dr. Afzal Sawal, and Dr. Vijaya Bashir. She will be joining slightly late, but she will be joining soon. So now I will hand over this meeting to Dr. Amr Birni to introduce his team and take it further. Thank you.
Thank you, Dr. Tariq Razak. Very kind of you. Assalamu alaikum, everybody, and Bismillahir Rahmanir Rahim. On behalf of the Association of Pakistani Physicians of Northern Europe, I would like to, first of all, thank you for the invitation from the 3MEM organization. I think you're doing some wonderful work, and I think it's a very good opportunity, not for us, but for my colleagues here, who I'm very grateful to the team, the panelists who are going to present. They are all medical students, and some of them have just recently graduated. So first and foremost, I must thank the team. We will introduce them as we go along. In fact, I will request when we do the presentation that you also introduce yourself as to who you are and what year you are you in medical school, or if you have recently just graduated. I must thank our 2 mentors, Afzal Sawal sir from Apne. There's a lot of work which has happened in the background. Dr. Mr. Jafar Boy, Mr. Naseem Waraj hasn't been able to join us. He was the moderator originally, but he is, I believe, operating at the moment. So that is the life we live as medics and surgeons, that we can be called upon anytime. But inshallah ta'ala, we are hoping that he will join in and take over the moderation. So Association of Pakistani Physicians of Northern Europe is the largest democratically elected organization in Northern Europe. So our base camp is quite a lot of it in UK, but we are spread out into Ireland, the Republic of Ireland, and also beyond into Europe. So the people standing in front of us, my young colleagues, are the future. They are the bloodline of this organization. So hopefully this will lead to you guys becoming members in future and also leading the organization. We are here to stay. So without any further ado, I would like to move on to the presentations, because this is what we are here for. And I hope that the audience will benefit from it. I will encourage that if you have any questions during the presentations, not to ask those questions then, but to type them into the chat box. Me and Dr. Razak will be looking at the chat box, and we will direct them questions to our students and the panelists later in the Q&A session. So the first hour or so is all about presentations, and then we have an extensive Q&A session. If we cannot get to your questions, we will try and respond via email. So inshallah ta'ala, we are hoping for a hyperactive, interactive session. It's all about you asking the questions and we talking less. So I will keep quiet now. I will go on to our presentations immediately. I'm going to first of all request Hiba Mirza, who is going to talk about tips for preparing for the A-level examinations. I know a lot of you have the exams coming up and slightly stressed, so we have Hiba is going to talk to you about her top tips for preparing for A-level examinations. Over to you, Hiba Mirza.
Hello, so my name's Hiba and I'm going into my 3rd year in September, and I'm just going to be talking about A-levels. So I've made a presentation and I'm just going to share my screen. Can everyone see that?
Yes, we can.
Sorry. Okay, so I'm going to be talking about A-level tips. I'm going to first do an overview about A-levels, and then I'm going to move on to revision tips, and then also some ways on how to deal with stress. So first of all, I'm just going to talk about A-levels. So you do your exams at the end of year 13, and you need a minimum of 3 A's. So some universities require you to get an A-star, AA, so make sure you check those requirements. And you have to take biology and chemistry, and you can take any 3rd subject. It doesn't have to be maths. A lot of people think they have to take maths for medicine, but they don't. So my advice would be to take a subject that you enjoy and that you're good at. So I took Spanish and I found that quite easy, and that allowed me to spend more time focusing on chemistry and biology, especially chemistry, as that can get really hard at A-level. So just some revision tips. The number 1 advice I would say is to do past papers. Do every single question ever, because there are only a limited amount of questions that they can ask you. And then also download the specification. So each exam board has the specification on their website. So you can download it, you can print it off and highlight exactly what you need to know, because they can't ask you anything beyond the specification. And then I would say avoid making notes unless it's brief or of definitions. And the questions that they ask you are more application based, so memorization isn't enough unless it is just plain definitions. And then I would say you need to understand the concepts fully. So you can ask your teachers for extra help. You can even watch some YouTube videos. So I would recommend Khan Academy and Snap Revise. They're really good for biology. And then for chemistry, there's a website called Chem Revise, which I used, and it has all the condensed notes of every single topic in chemistry A-level. And then just moving on to ways to deal with stress, because I know A-levels can get very, very stressful. And I would say start from day 1. Give yourself plenty of time to learn the content. However, it's not about the quantity of revision, it's about the quality. It's about how effective your revision is if you're actually understanding what you're learning. And it's also very important to take regular breaks. So in your breaks, you should do something productive, something to take your mind off all the stress and the exams. So exercise, listening to music, taking a walk and stuff. So make sure you do things that you can take your mind off. And then also make sure you have days where you can relax. Go out with your friends, go out to eat. Don't just revise 10 hours a day every day, because you'll burn out, and that's not what you need, because A-levels are a marathon, not a sprint. So that's it really. That's my advice. Sorry, it was very quick, but yeah, that's it.
Well done.
Stop sharing the screen.
How do I stop sharing the screen?
Just stop sharing the screen.
The host can do that.
Cross it. Don't stop.
Who is going to present next?
Okay, I'm going to announce the next person. So thank you, Hiba Mirza, for that really informative and really fantastic top test presentations. So as I said, these are top test presentations. They will generate some questions, and we have those questions for Q&A session later. So thank you, Hiba. So I'm going to go on to the next presentation. So I'm just making sure that I've got the right running order, and we are going to request Ms. Nabaha Fad to please present her topic for today.
Yeah, so my name's Nabaha. I'm a first-year medical student. I'm going to be talking about how to apply to medical school in the UK and Europe. So these are just my top tips for applying to medicine in the UK. So the one thing that I would say to take away from what I say is that you just need to play to your strengths. The first thing is, it's kind of obvious, but you need to be, you and your teachers and people around you should be confident that you can achieve your predicted grades. So most universities need 3 A's, but some of them need 1 A star or 2 A stars. And if you do apply to those, then I just say that you need to be confident that you can achieve that, because otherwise you're wasting one of your spots anyway, and they're quite limited. Another thing is that research each individual university that you apply to, because they all have different criteria. So some focus on your GCSEs and they rank them against a point system. So some universities like that are like Birmingham University and Leicester University. And if you have strong GCSEs, like loads of 9s and 8s, then I'd say that you'd have an advantage there and you're more likely to get an interview. But then on the other hand, some universities also focus on your UCAT score, and they rank that. So if you're stronger in your UCAT or stronger in your GCSEs, it just depends on which university take those, and you should focus on that. Some universities also don't hold that much weightage to GCSEs and UCAT. You just have to meet a minimum criteria and then you get interviewed. Like one of those is like Manchester, which is you just need to get in the top 30% of your UCAT score, and then you get an interview. So one thing that so it's really important that you look at each university, because otherwise you only have 4 or 5 choices. So then you don't want to focus on the wrong kind of criteria and then limit your choices straight away from the beginning. You want to be smart and strategic and play to your strengths, not the general league table or anything, because that can come after. First, you should look at where you're more likely to get an interview. One website that I would recommend using is the Medical School Council website, because they have all of the universities in the UK there, and they have all the like entry requirements and the interview process. So that's really useful. And then when you're applying to medicine in Europe, this tends to be like a plan B or plan C for most students, because in Europe they need a lower minimum A-level grades, and you'll need to do an entrance exam. So there's 2 websites here that I have, which is Study Medicine Europe and tutelage.org, that are really useful. And normally if you do look into this, there's an agent that guides you from start to finish. And but it's important that you look into this and also other backup options. You can do another course. Some people take gap years. So when you are applying to medicine, it's really important that you you make all five options that you have. You focus on what you're gonna excel in the most. So wherever your strengths lay, apply to those universities. And then if you do a backup plan, to make sure that you're also confident in that, and that you are actually willing to do that, whether it's redoing your A-levels or going to Europe or doing another course, or applying to 5 medical universities. So yeah, that's mostly what I have to say. Yeah.
Okay, thank you very much, Nabaf, Abid, and I think once again we have got a lot of information there. So this is being recorded, so people can obviously see them after. But again, if you have any questions, please do write them in the chat box. Okay, so we are now going to move on to our next presenter, and this is Haris, who's going to talk about how to study for UCAT, University Clinical Aptitude Test. So over to Haris.
Hi, my name is Haris. I'm a 2nd year medical student at the University of Liverpool, going into my 3rd year. And I'm just going to today just talk about how to study and prepare for the UCAT exam. So as most of you probably know, the UCAT exam is split into 5 different sections. One being verbal reasoning, another one for maths, decision making, abstract reasoning, and a situational judgment test at the very end. A lot of people find the UCAT exam a hard part of the application process, when in reality it's a lot easier than a lot of people make it out to be, mainly because it just requires a lot of practice. It's not an exam that you can prepare for like your A-levels and GCSEs. It's more of an exam where you just need to practice as many questions as you can and just familiarize yourself with as many different scenarios as you can. Verbal reasoning is probably the hardest part of the exam that most people find. mainly due to just time restraints that you have. You have a massive text to read in a short period of time. So I'd say my top tips for this section is to always read the question first and only read through the first 1 or 2 lines of the passage just to get a general idea of what the passage is talking about. And you need to learn how to skim through the passage rather than actually reading the sentences and trying to pick out keywords from the question. And I think what a good idea to do is also to look out for extreme words in the question. So a lot of questions will have words such as definitely or will always, and usually these questions will give you an idea of whether they are true or false. And they're usually words that are quite easy to pick up in the text as well. I'd say if you're struggling for time as well, especially during this section, just flag the question and move on. You don't really have enough time to afford to spend on one question more than the others because every question is worth the same amount of points. So I'd say make sure you don't miss out on the true, false and can't tell questions because they're usually the easiest. And for other questions like state the author's opinions or views, these questions are usually a bit harder. These questions usually require you to have understood the text fully. So I'd say if there's a question to skip, it's most likely these questions, but a general idea would be to look towards the last paragraph of these questions to try and find your answer. And yeah, obviously don't use any information outside, even if you understand the text or anything, just always stick to information that's inside the text. With the maths section, the maths questions are usually at a GCSE level standard, so they are quite easy. But again, just like with VR, this section is quite time restraint. So my main tip would be to know your equations. A lot of the questions in the QR are mainly revolving around speed, distance, time, original price, currency changes, areas and perimeters. So I'd say practice a lot of problem solving questions and always practice them under time conditions as well. And you're given a calculator as well that's on screen. So I practice using that well before the exam because it is quite inconvenient to use and it does slow you down quite a bit. So I start practicing using that quite early on. Most of the questions as well for the math section usually only involve around 1 to 2 steps. So I'd say the questions that are a bit more complex, I'd skip them and then leave them towards the end if you have time at the end. Because there may be easy questions at the very end that you might miss out on because you're spending too much time on one question rather than the other. And always try and estimate and round up numbers to more simple numbers so that you can save time, and then just choose the answer that was closest to the answer that you calculated. So for abstract reasoning and decision making, these 2 sections aren't really sections that you can really practice, like you can't really revise for them. They're just simply practicing. I'd say for abstract reasoning, try and find a strategy that works for you. So using the acronym SCANS, for example, determining the shape, color, arrangement, and size can help you try and find patterns a lot quicker. I'd say start using strategies like that early on, well before the exam, and eventually nearer to the exam, it will become more of a mental thing to just go through those conditions in your head, just try and find different patterns. And try and just do as many different questions as you can. There's so many different patterns to go through. I'd say a good idea is to also make a list of all the patterns that you come across as well. So near to the exam, you can just go through them and just brush up on them. And same goes for decision making. Just expose yourself to as many different types of questions as possible, and use the whiteboard as well to try and logically conclude your answers. So just to basically give you some general tips, I'd say plan on revising around 6 to 7 weeks before the exam. Most people say you'll need about 4 to 5 weeks. I'd say if you start a bit earlier, it'll be a lot more beneficial because you won't have to revise as intense, and you can familiarize yourself a lot with the questions early on, take it slow and steady at the start. And then nearer to the exam, that's when you can just up the revision a little bit. And always be aware of the timing. The timing is the main issue with this exam. Just practicing time and conditions as much as possible. I'd recommend Medify out of every source that I use. I think that was most close related to the exam for all the sections. And they give you mini mocks as well to prepare for. So you can try them nearer to the exam as well. And yeah, just try and be confident for the exam day. I know it's quite nerve-wracking, but by the time the exam comes, you'll have practiced quite a lot. So hopefully it should all go well. And yeah, that's everything. Thank you.
Who's the next speaker?
You are going to stop. Yeah, so I'm just going to request them to stop sharing the screen so we can go to the next speaker. You can stop sharing your screen, please.
Yeah, there'll be a button below your screen.
So thank you, Aris, for that wonderful presentation yet again. We have got now 3 presentations are running through. And before we go on to our next presenter, I would like to welcome our moderator for the day, Mr. Naseem Waraich has joined us. Naseem Waraich, I think we could see you earlier. You are here, I believe.
Yes, Amir Bhai, thank you so much.
I will introduce Naseem Waraich is one of our executive members. He's also a surgeon. As you can see, he's in his scrubs and his cap, so he's literally in operating theater room. And if he's called back again, he's called back again. But thank you, Naseem, for joining us. And I will leave the proceedings to you from here on. And you can introduce the next speaker and the speakers afterwards. Is that all right?
Thank you so much. My name is Naseem Waraich. I'm the consultant surgeon. I'm sorry, accept my apology. I've been called in to cover the sick urgently this morning, but on a condition that I can join this seminar later on sometime. Whatever I can say, if you decide to be a surgeon, just think twice before you decide it. And with experience, it's whatever you want to achieve, it needs a hard work, and people who hardly works don't achieve those. So let's go to the next speaker. It's future Dr. Asher Birney is a very talented person. I have not seen such a talented person who's doing medicine and some other activities as well. So let's see how he can highlight us on his personal statement issues.
Thank you. So I'm going to share screen. Just bear with me. There we are. Okay, there we are. So I'm going to turn the screen. Can you see Asher clearly? Is that all right?
Yeah, very good.
Yes, hello everyone. I'm Asher Birney. I'm a 5th year medical student. And today I'll just talk to you all about writing a personal statement for medical school. So firstly, just an overview for things I'll be speaking about quickly today. Just a few general tips and avoidable mistakes to begin with. Then the values you should try and demonstrate throughout your personal statement. And then also just talking about introductions, your work experience of volunteering, your extracurriculars. And I'm just going to finish up talking about a bit about your conclusion as well. So just moving swiftly forward. So firstly, just my first general tip is to be concise with the amount of words you use. You're quite limited to the amount of words you can use, and obviously as to redraft and cut down, you should try and cut down the words that you don't need in unnecessary areas, and you should try and be very clear and get to the point with your statements for your work experience and your volunteering. I would say dedicate the majority of your words, about 2/3, I would say, to your work experience and your volunteering, because these are the most important sections in my opinion. I would say have a clear structure and use paragraphs throughout your personal statement. Be sure to spell check it and make sure it's grammatically correct, because these are just easily avoidable mistakes. Try and have someone else read over it for you. Sometimes having an extra pair of eyes can be very useful. And of course, it goes without saying, but do not plagiarize or try and copy out people's personal statements, because UCAT will know, because they do check over that. So just firstly, I just wanted to have a separate slide to the values you should demonstrate, because I feel like this is quite important. There are many qualities every doctor should have. Examples include empathy, motivation, communication skills, teamwork, and leadership skills. I'm sure these are words and you guys have all heard before. But I think it's important to emphasize that you need to be able to reflect on these skills, not just state that you can have them, because anyone can just say on the personal statement that they have these skills, but it's through your experiences that you're going to be able to show that you've actually gained these skills through your work experience and your volunteering. Additionally to these skills, I think it's important to show a capacity for hard work, because as everyone knows, medicine can be a very stressful and demanding career choice, and medical schools will look to see that candidates have the ability to deal with this kind of stress. I'm going to touch upon that a bit later, how you can do that. And also, of course, it goes without saying as well, you can't include all of these qualities in your personal statement, so don't stress yourself out by trying to include as many keywords as possible. Just have a natural flow to your personal statement and try and include as many as you can. Okay, so just your introduction. So firstly, your introduction should demonstrate your motivation to study medicine. It should be straight to the point. It should show your passion for the subject. So as I said, it should be straight to the point. So it should be concise, relevant, specific. Try and use a unique experience from your work experience or from what you've seen growing up in someone that suffered from a medical condition to show your individuality and your interest in medicine. Because of course, everyone does biology and chemistry A-levels. Everyone has passion for the sciences. But it's also just about what your understanding of medicine is as well, and how you've had work experience to show this. Be engaging and show a combination of academic experiences. I'm not saying it's bad to talk about your A-levels. Of course, it can be very useful to show that you do have a passion for sciences, but do remember that medicine is more than just a science. It's also about helping people as well. And of course, it goes without saying as well, but be confident as a candidate, but don't be arrogant. You're not a medical student yet or a doctor yet. So do be humble in the fact that you've had a decent experience with your work experience. So moving on to your work experience and volunteering. So like I said before, dedicate the majority of your personal statement, about 2/3 to this section. Pick your most valuable experiences and focus on them. I'd say just 2 or 3 from your work experience would be fine. Try not to add too many experiences, because eventually you'll seem less genuine when you're talking about each of these. And again, you're limited for words. And then the key thing is with your work experience and your volunteering is to be reflective and not descriptive. It's not necessarily about what you did, but it's more about what you gained as a person from what you did. So if you've seen a few patients in a GP surgery, it's not just about what patients you saw and what conditions they had. It's more about what was the approach that you saw the doctor demonstrate in the GP surgery, and how are you going to take those skills that you witnessed and apply them to your own practice and move forward with them. So again, so like I just said, so any values you state you have, evidence should be provided, and I just said how you could do that. Try and achieve a balance between your understanding of the scientific aspect of medicine, but also the patient experience. So what I mean by that is, if say you did have a surgical work experience and you really enjoyed looking at the anatomy during the surgery, it's not just about, of course you can mention that you have like a great interest in science and how it's really exciting, but also talk about like the patient experience. So how did the surgeon comfort the patient? How did he explain the procedure to the patient before he did so? Things like that. And of course, if possible, I know it can be quite difficult for some people to try and get long-term commitment and volunteering and work experience. It can be quite difficult for some people. But if you do have a long-term commitment with your volunteering, if you have been volunteering for a year or so, try and maybe add that in, because it does show that you can commit to something. And it does show, again, organization, if you've been able to balance this along with your social life as well, which is a very important skill that you should have as a medical student and moving forward as a doctor. And again, like I said before, I'm just trying to really emphasize this. Reflect on your volunteering. It's not just about what you did. If you worked in a charity shop or if you worked as a healthcare assistant, it's not just about what you did, but it's more so about what you've gained from these experiences, how you, say if you worked in a charity shop, how you worked in a team with the people around you, and how you demonstrate good communication skills. So now I'd like to just touch on also about your extracurriculars. It's important to have these thrown in, but like with that final third of the words that you have to spare, to demonstrate some other values that you have. So again, if you played sport in school, you could demonstrate that you have good teamwork and communication skills. Again, this can be done with other things such as DOV or any other extracurriculars that you may or may not have. Additionally to this, like I mentioned before, it's important to show that you have the ability to cope with stress and demanding workload. And this could be done through a majority of ways. For example, if you play instruments, you could say that this is your pastime. It's quite a productive pastime. It gives you patience as well to try and learn this new skill. Again, you can show commitment that you've been able to balance your hobbies along with your extracurriculars and your workload from A levels. And this is just, again, just show that you have the capability to organize yourself and deal with the situation, because again, medicine can be a very demanding career and it requires quite a lot of organization at times. And then just to finish off with your conclusion, just like your introduction, it should be concise and it should be engaging and it should leave a lasting impression. And it should just highlight some more of your positive qualities that you demonstrated throughout your personal statement and how you have the determination and the motivation to study medicine and moving forward to become a doctor at a higher level. So thanks for listening. That covers everything I'd like to speak about today.
Thank you so much, Ashar. It's a very succinct and to the point presentation. We will go to the next topic, which is a special interest for me because I do undertake the interviews for junior doctors. So we're gonna listen from Fiza that how to nail on the day to secure your post in medical school. And I believe that's the most important one because it's a one-day match for you to perform there and achieve your targets. Yes, Fiza.
Hi everyone. So I'm Fiza. I'm just starting my 4th year. If you just give me a second so I can share my screen with you all.
Who is the next speaker? Let me check if he or she has got the admin access, post access or not.
The next one is.
Yeah, we can see the screen.
I'll see that. So I'm going to quickly be talking about interview skills. So an MMI is a multiple mini interview. There's around 6 to 8 stations of around 5 minutes each, but this can vary. It's just an approximation. And between the stations, you usually have around 2 minutes to read the question and have a little bit of thinking time. So this is the format of interviews used by most medical schools in the UK, and there's just a list for you guys to look at. So I'm just going to quickly talk about the common types of questions that you might get, just to give you a little bit of an idea. This list isn't exhaustive, but I'll just give you a flavour and an understanding of what you should be preparing for. So there'll be questions asked about your skills. There can be motivation to do medicine questions, the most common one being what made you decide to go into this field. Work experience and volunteering related questions where you should give examples from the work experience and volunteering that you've undertaken. Role play questions where there might be an actor and you have to read a scenario and you go into it, and for example, common one is Breaking Bad news. So you'd have to go into that and show your communication skills and how you would approach that situation. There's also ethical questions, and this I'll go into a little bit more detail later on. And a final note is just that some questions might not seem like they're directly related to medicine, but all they're trying to do is see your skills. So for example, your communication skills or your problem solving skills. A common example that sometimes you might get given is to do like a puzzle or something like that, and through that they're just trying to see how you would go into that, how you would problem solve, and if you're able to communicate whilst doing that. So my top tips would be, number 1, timing and structure. So make sure you know how long you need to be speaking for and practice using that time scale, because you don't want to be running out of time or not saying enough. It really helps if you can get someone to listen to you, because it kind of puts you in that pressured situation beforehand so that you're not panicking on the day. Practice interview settings can really be useful for this. So sometimes schools can organize practice interview sessions. So if you get the chance to do that, I would definitely recommend going. A structure that I like to use, and obviously you can tailor this to whatever you find is best for you and what suits the question, but a quick 1 sentence introduction and then go into your points. I would say around 2 to 3 points was useful for me. And then if you have time, you can summarize. So it just organizes your thoughts a little bit more as well. And when you're speaking, that comes across better to the interviewer. If you get prompted by the interviewer, don't panic, because they're just trying to do that in case you've gone off on slightly the wrong track, and just use that as an opportunity to come back on the question that they've asked you. And if you do finish early, that's okay. But I would recommend, again, making sure that you are using the time that's given, because it's there for a reason. Secondly, I would say stay up to date with recent discoveries and healthcare related news, because a lot of the time there's a lot of news about the NHS, so it's good to know about these things generally, and also for your interview, because it will show that you're interested and it's a genuine interest that you have. I'd recommend sources like the BBC News app, where you can kind of filter what you want to look at. So your news, you can pick like healthcare or like discoveries, scientific discoveries, and then when you go on that app, you can see all those recent articles. Medic portal, so I've included a link at the end, which you guys can go and check out. And you can be asked about these things, so it's just good to know. Thirdly, I'd say do your background reading. So for the ethical questions, it's important to know about the 4 pillars of ethics. Again, I've included a link so that you guys can look at this in more detail. And also knowing about laws to do with healthcare as well, such as about euthanasia and common topics like this. It's important to know what is legal in the UK, so that if you're asked about them, you're able to use that in your answers. A little bit about the history of the NHS, or any NHS scandals. Again, I've included a link, so once you come to that stage, you can look at that and read about it. And lastly, I'd say as well, read your personal statement. You can often get asked questions about this, so you don't want to say anything in your personal statement that you won't be able to talk about in your interview. Make sure you know everything that you've written about, and you can go into more detail about it if you're asked to do so. Fourthly, I would say emphasize what you learned and gained from different experiences. So from your work experience, your volunteering, any extracurricular activities that you do, a part-time job that you might have, anything that you've done and you've written in your personal statement as well. Make sure you emphasize in the interview what you've learned from it and what you've gained from it, because it won't be useful to the interviewer or for you to just tell a story and be descriptive, like, oh, I did work experience and I saw this. You want to really show them that you did it for a purpose. So emphasizing what you've learned is a really important thing to do. And finally, I'd say be prepared, and by that I mean obviously doing all of the above, but also just simple things like make sure you've read the email that the university sent you. And it sounds really obvious, but if you are prepared in terms of knowing the time limits and knowing any extra documents you need to take, it will make sure that on the day you don't have any extra stress or pressure. And don't panic, because you're there for a reason. You've been invited to the interview for a reason, and just be confident in your answers and believe in yourself, and that should make sure that they see why you deserve a place at the university. Here I've just got a few links that you can look at in your own time, and that's all from me. Thank you very much for listening.
Thank you so much, Fiza. It was very informative, and I hope it will help all of our listeners to improve their interview skills. So it's time to move to our 5th speaker, and we're going to be learning about top tips to prepare for your A-level exams. So I will request Hiba to tell us something about top tips for passing A-level exams with good grades.
I've already done that. That was at the beginning.
That was the first one. So we'll just go back to the list.
Is it number 6 now?
Yes, number 6 after Fiza, please.
Right. So we're gonna invite Zaina to tell us how to enjoy your medical life.
Yeah.
Thanks.
Yeah. So hi, I'm Zaina. I've just finished first year of medical school, and I'm going to be talking about what life at medical school is like. Okay, so bear in mind that it can vary quite a bit depending on which university you go to, the teaching style that university does, as well as what year of medical school you're in, but this is just an example of how my first year was like. So I thought the best way to show it is to actually show you my timetable. So this is an example of a busy week. So to give you a bit of context, we learn system-based, so we start off with lungs, heart, look at limbs, etc. And each week is subdivided into different themes, so different diseases. So this week is an example where we were learning asthma, but other weeks will be heart failure, pneumonia, cancer, etc. So the week and each day is kind of a mixture of lectures, hospital visits, GP visits, anatomy, histology, optional modules. So our day tends to go from 9 a.m. to 4 p.m. And we end the week with a plenary session. So we have a case of the week, and normally a doctor of the relevant field will come in and discuss that case with us at the end. So this week was about 27 hours content. So it is a lot of workload. It's a step up from A levels. So it can be stressful to deal with everything, but they normally try and give us half a day off where we can do other things. This is an example of a non-busy week. So it normally starts later on in the day. Sometimes we get full days off. So it's a lot less contact hours, and it tends to get less busy closer to exams. So it's a good time to catch up and work, do revision and socialize. But apart from that, there's obviously non-medical stuff as well. And these are good ways to de-stress. So med school is truly what you make out of it. If you want it to be all about studying, then you can just study. But to make the best memories and gain the most experiences, it's good to try and do things outside your course. So whether that's going to different societies to meet people outside medicine, exploring the city, doing trips out, eating out, that helps to get your mind off medicine and have more fun and get more out of it. So yeah, that's it.
Thank you so much, Zaina. I think it's a good insight, and I was just regretting that I should have studied here with such an organized way. We didn't have that much organized studying timetable back home. So our next speaker is going to be Hassan, I believe, and I think he is a good cricketer too. So he's going to tell us about some intercalated degree. Hassan, please, thank you.
Share my screen. Is that working?
Yeah, you're not watching Pak versus West Indies match today, or Pak versus England match today, is it?
Well, I'm not allowed to because I'm here now, but I will do afterwards. I'll catch up with the highlights. Okay, so assalamu alaikum everyone. So I'm Hassan. I'm in my 5th year of medical school. I just wanted to give you a quick talk about intercalating during med school. I think it's I think it's an amazing thing, and I chose my university based on the fact that it's actually compulsory, which is UCL, and I know a few different unis as well. They sort of give you the choice, and there are a lot of pros and cons about doing an intercalated degree. The main cons that people sort of focus on are med school's so long anyway. Why would you want to add another year? People sort of go on about how it's actually not necessarily that relevant to their career as a doctor, and also just about the fact that they think actually, you know what, they just don't actually like the idea of going on to do something different, and that's because naturally, if you're a medical student, you're really fascinated by, I imagine, the human body, how it works, and actually different pathologies and diseases. And actually, I would disagree with all of those 3 main cons. Because the first one about med school being so long anyway, I think for me personally anyway, I've sort of viewed as soon as I start med school, that's essentially the start of your career. because from then on, we're very fortunate compared to many other careers where actually we're almost guaranteed sort of jobs and placements after university when we graduate. And I know many friends that are doing top degrees and really struggling to find jobs. So as soon as your career starts at med school, it's just a long slog until you're a consultant, and then you've still got a long time after that. So actually taking 1 or 2 years out in the grand scheme of things does not make a big difference. I've actually taken 2 years out. I took 1 year out just because I just wanted a bit of a break and just to go relax for a bit, to be honest. And then I took 1 year out for the intercalated degree. So I've now got friends that I went to high school with who are now F1s. And yeah, it is a bit weird thinking, you know what, I'm actually still in my medical degree and they're now actually actual doctors that I could potentially be learning from. But again, in 10, 15 years time, is it going to make that much of a difference? Probably not. But the things that I would have learned over those 2 years off and doing that intercalation are far better. And one of the things people say about actually it's not clinically that relevant, I'd also heavily disagree with that. And these are some of the examples of intercalated degrees that you can do at UCL. And a lot of them are sort of medical related. Some of them actually, they all kind of have to be a bit medical related, to be honest. But they go off in all sorts of directions. You've got sort of maths and computing, you've got research, you've got things about history and philosophy of science and maths. So actually, I know one of the other students was talking earlier about actually doing a different A-level that you'd enjoy. I know some people sort of go off and do different subjects in that year off as well. So if you did actually choose something like history as an A-level, because it was something you are interested in as well, you have the chance to do that here. And sort of the big one that people love at UCL is neuroscience. And that's because we're affiliated with Queen Square, and it's one of the leading places in the world for neuroscience. So if you have the chance to carry out a research project there, people love that opportunity. And again, at your different respective universities, there will be leading researchers in different areas. And so sort of having that chance to learn from the best of the best about something different that you're interested in is a really valuable opportunity that I don't think you guys should miss out on. So me personally, I chose sports and exercise medicine. So again, I was really lucky because UCL is affiliated with the Institute of Sports and Exercise Health, which is one of the few centres in the world which was basically set up when the London Olympics happened in 2012, because they wanted to do a lot more research into sports and exercise medicine. So these are actually pictures of our labs here and some of our students sort of doing some different work, and they have some amazing equipment there. They sort of have chambers where you can really suck out and go into high altitude for sort of training and fitness to see how people develop there. They have things called CPET testing, which I'll just discuss a bit later on. So I'm actually just going to talk a little bit briefly about the BSc, sorry, that I did. But again, like I have lots of friends that all did these different topics as well. So if these are something that take your interest, then by all means ask me some questions and I can sort of answer vaguely about the kind of research that they did. Again, the great thing about having sports and exercise medicine at the ISCH was they're leading experts there. We had physios teaching us that have been physios at the Olympics, that have done physio for football clubs. Our lead was sort of chief medical officer at different football clubs as well. And my research project was actually part of a project which was working with the England's women hockey team. Some of my friends were working with the Reading football team as well. So they'd actually go out there weekly and go do their tests on them. One of my other friends it wasn't with the Welsh national team, but it was with the Welsh professional rugby team. Some people went out to AFC Wimbledon as well. So even just sort of the people that you meet and that networking, which is so important in medicine, it gives you some really, again, valuable opportunities that I don't think you should miss out on. So the thing about not being applicable to medicine, which I mentioned earlier, which some people see as a con, again, I completely disagree with, because I think some of the skills that I learned over this year off were just phenomenal, and you will not have, you won't get otherwise. Because as a medic, you rely heavily on what you will be prescribing, what treatments you'll be doing and offering based on research that has been carried out. And I think it's really important, therefore, to sort of know how that research happens, where it comes from, and what actually goes into it, to really sort of nail in to your mind as to how important a lot of it actually is. And sort of the chance to do a dissertation as well. I absolutely hate writing. I hate essay subjects. When I found out that med school exams were all SBAs, I was over the moon because I didn't have to write anything ever again. But actually, when I got to my BSc, I thought, I really want to learn how to write. I want to learn how to research. I want to learn how to sort of write a scientific paper. Because again, people think that writing and research isn't really to do with medicine, but again, I completely disagree, because medicine is very much centered around your patients and what's best for your patients, and that comes from research. So just quickly, my dissertation was on the effect of sort of exercise on a screening tool which is used for concussion. So this is sort of it's one of the sideline tools used to quickly assess if someone's concussed. With concussion, you actually can't, it's not necessarily a straight diagnosis, it's sort of a clinical judgment. So I was looking at, say, how if someone was on the sideline and they were in a clash during a football match, actually how reliable are these tests? Because if they're influenced by people being tired anyway, then actually you might end up with false positive sort of results. And that's what I looked into. And again, some of the skills that I learned, you have to develop all these skills to analyze statistics like here. You also have to learn to develop posters and learn how to present them to your peers and other academics as well. And also make infographics for members of the public who are going to be carrying out this test, and you need to explain it to them, and also presenting your work just to general members of the public as well, so they can kind of get an idea of what it is. And then you also do loads of different modules as well. So these are just a few examples of the things that I did. So because one of our modules was heavily around rehab, we were sort of taught about different rehabilitations for different injuries. I then produced an essay on sort of how an elite athlete would go through a rehab program if they just had a patella fracture. Other students had different injuries. Again, then the muscle physiology side, and I absolutely loved this because I think it really sort of, if you're into gym, if you're into fitness, it really kind of goes into actually the science behind it and what is sort of what is some of the best techniques to do. So the essay title I had was sort of a training regime for an athlete that's a baseball athlete, I think it was, that needs to kind of work on their throwing skills and strengths. So then you kind of research into the actual best exercises for that, the different eccentric, concentric exercises, those sets and reps, and actually what the difference is there, whether you're going for hypertrophy, strength, all those kind of things. And again, then you develop your own plans, you develop your own exercise regimes. And again, like I said, I'm interested in fitness, I like playing a lot of different sports, so I like training for the different sports in different ways. And actually having all that knowledge behind you as well. And the most important thing was on nutrition. It completely changes how you view things like sports training and people that try to lose weight, and you can really help your friends and family as well. And then again, just about it not being medically related, one of the things I mentioned earlier was CPET testing, and that is so important in the clinical settings. Uncle there, who was saying he's a surgeon, I know one of the things that they'll do before an operation is they'll sort of test their cardiopulmonary exercise testing because they want to see how fit they are cardiovascularly and respiratory, because if they're not, then that's going to be one of the most adverse outcomes for them after the operation if they haven't got that good fitness. So again, understanding where that comes from, why you do it, it's so important. And again, you do case presentations sort of for exercise prescriptions, because actually medicine isn't just about the pharmaceutical side. It's so heavily dependent on lifestyle changings, on rehab. So we'd all get given sort of a different topic. So mine was COPD, and I'd have to go and research actually how important are these first steps of rehab, quitting smoking, doing different exercises, actually compared to, say, giving them medications. And you realize that with the majority of things, actually the first step, the first line treatment is always going to be quit smoking, do pulmonary rehab, or quit smoking, get exercising. And sort of knowing where that comes from and actually knowing how to do that and why it's important will completely revolutionize actually you as a medic and you as someone that's trying to help someone in a much better way. And then just quickly to wrap up, so this is then similar for all BScs. You get so many amazing opportunities to present your work. And again, this is something where if you didn't take out a BSc, it's very unlikely you'll get the chance to do that. I'm still sort of working on trying to get published and trying to get my posters out there to these presentations. And it's amazing. I know friends that actually, from my previous cohort, they traveled out to, I think, Amsterdam, two of them with the professor that they were studying with, and they presented at conferences there. I know people that have flown, loads of them fly abroad to just go present. It's all paid for, it's all fantastic. And then on top of that, if you are, I don't know how much of you guys know about the applications for actually at the end of your medical career, at the end of your medical degree, sorry, but having a BSc, having presentation gives you a few extra points on top of your SJT results and actually how you do in med school. So there's all these different bonuses that you can get from doing a BSc, as well as the skills that you learn. And like I said, it's also just a really nice breakaway from medicine. Because a lot of, like I said, it's a long slog. It's what you're going to be doing for the rest of your life. So actually taking a year out, doing something different, I would highly recommend it. I've spoken a lot about sports and exercise medicine, but like I said, there are a lot more. If you have any questions about this in particular, or just generally BSEs, just post them in the chat and I'll try and answer them later. But I think that's everything from me.
Thank you so much, Hassan. Looks like you have cleverly chosen very exciting topic that you don't get bored during your research. And now I know who to contact when I'm bowling and getting some sprains in my shoulder.
There you go. Yeah, it really helps with OSCEs and sort of that clinical application.
And the bad news is Pakistan is all out 169 and given 277 target.
It's still defendable. It's still defendable. We'll see how it goes.
Let's see. So we're going to go for our last but not the least topic is how to enter into dentistry and how you become expert to put a confident smile to your patients. So let's hear how we can get into the medicine.
Right, let me just share my screen.
Is it Mahanur?
Yes, it's Manur.
Yes, Manur.
Yeah. Can you all see that? Yeah?
Yes.
Okay, super. So, hi, my name is Manur, and I'm just going to be talking to you all about applying to dentistry. So, I graduated last year, and I'm currently just finishing my foundation year at home in Nottingham. So, firstly, I just thought I'd talk about the differences between medicine and dentistry. So, I'm sure we all know that medicine is a 5-year course, but dentistry is as well. Some people are under the misconception that it's a 4-year course, but no, both are 5 years and they're both respected professions in their own right. And just making it clear that dentistry is not a backup for medicine. They're both very challenging degrees. If you want an easy degree, I wouldn't say that dentistry is the easy way out of medicine. They're both healthcare. So just remember, with dentistry, you essentially graduate as a GP with specialisation of the mouth. So it's a lot of routine treatment, but with a large element of problem solving. So each mouth has a different problem and you need to come to a solution as to how to fix that problem on hand. And in dentistry, you also have further opportunities. So you can either specialise in future, you can stay in practice as an associate general dental practitioner, and then you can take private courses to enhance your skills and to use them in practice. So things such as facial aesthetics, things such as quick sort of orthodontic solutions like Invisalign, composite courses to make nice smiles, you know, bits and bobs like that, which are all popular on Instagram at this point in time. Or you can go very much research based. As we've spoken about intercalation just now, again, you can sort of take those skills, take them with you back to university. If you want to do a postgraduate master's degree in something, you can undertake further research and also just go down the line of academia. So at university, both dentistry and medicine do have high number of contact hours. I graduated from Leeds, and in Leeds, it was a thing that dentists did have more contact hours than the medics did, especially in the first few years of the course. But then the flip side is that after graduation, as a dentist, you do have a lot more flexibility regarding the working hours compared to medicine. For example, regarding foundation training after qualification, dentists have to undertake 1 year of foundation training within the NHS to be able to work in the NHS in future, whereas in medicine, it's 2 years of foundation training. And lastly, we don't have any on-calls or night shifts, which is always fab. So these are just a few about the main entry requirements. So academic based. In terms of GCSEs, most universities will ask for your standard GCSEs, including triple science, English and maths. The websites do vary. Some say that they want Bs to A stars, but most people applying for dentistry, likewise with medicine, A stars and As. I think the numbers now, and I think it's sort of 7s and 8s, correct me if I'm wrong, I'm not too familiar with the new system, but the higher grades, that's what you want to get, even at GCSE. And then again at A-level, minimum of 3 A's, and you need to include chemistry and biology. The third A-level tends to be a lot of flexibility, similar to medicine, as we've discussed. And lastly, you might need to do some additional entry tests. So I had to do the UCAT. Leeds don't ask for it, but they do ask for the BMAT now. So just make sure you have a look at the university websites, just so you know what the minimum entry requirements are. Sorry, did it say that somebody just raised their hand? I don't know if we're doing anything about that at the moment. Shall I just keep going, answer the questions at the end? Yeah, that's fine. So then, as I think Asha spoke about personal statements, very briefly, just telling you again, personal statements are very personal to you. There's no one formula that will get you in, as they want somebody who will stand out. And the personal statement little segment that we just had, again, for dentistry, very much similar. So just make sure you do tailor your personal statement to the entry requirements on websites. And just remember that with the personal statement, as long as you hit your minimum entry requirements, universities do tend to be quite good at giving you interviews, the interviews where you really want to shine. So read what the university wants and tailor your personal statement to that. So these are just a few things that you can include in your personal statement. So just remember that, again, work-life balance is key. For dentistry, you do want a range of extracurricular activities which are non-healthcare based, exactly the same as medicine. So a few examples: any sports you play, drama, music, like Asha mentioned. It is just to show that you can handle stress, what you can do to manage with the stress. One key thing though is just really do highlight any activities that you do which enhance your manual dexterity, because with dentistry it's a lot more sort of, you work in a very small space, you want to make sure that you've got the right skills to be able to do fillings, root canals, things like that. So I think I wrote my personal statement about cake decorating or mehndi design, things like that. You can just include them, make sure you do include an element of that. For the guys, I know that some of my friends actually wrote down that they play a lot of PlayStation and using the controllers, because that also enhances your manual dexterity. So you could put that in. Again, volunteering, not essential, but all your peers who will be applying will be doing that sort of thing. So do make sure that you gain some volunteering doing anything really. And again, work experience, it's not just a personal statement, it's really useful for you. So for me, when I was applying for dentistry, I actually, when I was like in year 11, I did some work experience with my dad at the hospital. My dad's a doctor. And then I realized going to the work experience, I absolutely hated the hospital setting. I didn't find it interesting. I just found it quite not nice. Kind of ironic speaking to probably a room full of medical students, but yeah, I just didn't really enjoy it. It wasn't my cup of tea. So then I did some work experience at a dentist and I realized it's a lot more for me. I just preferred the work they were doing. I preferred the setting. It all seemed more me. So hence I applied for it. And then just finally, just make sure, like I'm saying, do your research. So make sure you go to open days for universities. I know that it's very difficult right now with everything going on. Virtual open days, I think, are happening. It's not, obviously it's not the same, but at the same time, do research the city. 5 years is a long time to spend in a place, so make sure you do like the vibe. And again, look at the websites of the universities, speak to students who you might sort of get in contact with. I know that on an open day it's a bit easier because you can make those contacts, but I don't know if the virtual open days have any students sort of giving you virtual tours. You might be able to ask them questions about that, how they're finding university life. Again, interviews, similar to medicine, either multiple mini interviews or you can also have traditional interviews. And I think Fizza did a talk about that. And again, just make sure you do look into your university course structure. Some courses allow you to intercalate, like Leeds, they allowed us to do that. You can undertake electives and some courses. And also just make sure you do look at how early you start seeing patients. I don't mean to sell leads, but I know that for my course, what was really good about it was that we did get to see patients in our first year. So that ultimately makes you a better communicator, more confident with treatments that you'll be providing. Whereas other universities do wait a few years before they start seeing patients. So up to you, but I would say earlier the patient exposure, the better. And good luck. I'm happy to answer any questions if anyone has any. So,
Great. Thank you so much, Manur. It was quite insightful for all of us.
Yeah.
Dentistry is an important one, but less talked about in our community. Not many people look for it, but especially it's important for people who doesn't like hospital environment. I would now like to invite Miss Wajiha Bashir, who's a practicing dental surgeon, to give some more advice. As I said, for a general surgeon, you think twice before you become a general surgeon because of the lifestyle. But I believe dentistry lifestyle is lavish. Dr. Wajiha Bashir.
Hi, Assalamu alaikum everybody, and good afternoon. Yes, it's a lot of medics on here, isn't it? So Manur, we're really gonna put it out for dentistry today, okay? So I'm just gonna share my screen with you. There we go, is that all right? Can everybody see that? Is that all right?
Yes, we can.
Wonderful. Okay, so as I was introduced, my name's Regia, and a little background about myself. I graduated from Manchester many moons ago, so I'm going to say over 13 years of experience, both in NHS and private dentistry. I have been a DF1 trainer as well, so I have trained newly grad dentists. I've done lots and bits and pieces over the years and kept myself busy by doing Royal College exams, and now I'm doing surgery. I'm back in theatre with implantology. So, and I am passionate about my profession, absolutely love what I do. So I hope I can give you an insight of why I love what I do. So Manu's already touched base on kind of the pros and cons, and to, you know, if you're thinking about medicine, you're thinking about dentistry. I faced the same dilemma many, many years ago, but I was very passionate about being a surgeon. So I was a very hands-on orientated person, but I also wanted the flexibility. So, and I knew maybe in medicine with the long hours and you know, it would be very demanding. So, and I may not be able to do the hands-on experience straight away that I wanted. So that's one of the big pros about dentistry. If you love working with your hands, you love getting in there, you know, you like to do things, and you like to manage patients early on, you know, that's definitely a big pro in dentistry. It is flexible, so you do have flexible hours. You can either work in general practice, or you can go into community, you can go into hospital. You can choose, because you are almost self-employed, you can choose whether you want to work 2 days a week or 5 days a week. After I had my children, I decided I wanted to just work 3 days a week, and now that's going up as my kids are getting older. So there is more flexibility in dentistry, where you're kind of stuck with certain hours, I know, in medicine. And you also have a big plus, which is a potential to have your own business. So if you are a bit of an entrepreneur and you have that business mind, you know, you do have that option in dentistry. You can have your own practice, and then you can expand. So you have a potential to be your own boss. However, I am going to say, Manu, this is not to scare you or any potential dentist that might be thinking this is, you know, what I want to do. There, you know, dentistry is very, very, very stressful. In many ways it's stressful because litigation is, you know, our profession unfortunately sees a lot of it. Not just in the UK, generally I think America, all over the world. I think potentially because it is an invasive field, so, you know, there's very little things you do in dentistry which is basically just kind of at distance and you refer. You have to get in there, you have to do something. So it's a very invasive profession. And you are dealing with money. So, you know, the financial sides of things, that you have to be able to be comfortable talking to your patients about money, you know, and that, so there is litigation involved, and obviously physically demanding, because you are doing something from day one. You find that dentists struggle long term with physical health, so whether it's their back or neck, you know, wrist injuries, you know, arthritis. So these sort of things, you know, we don't take it lightly when you're young, but you know, trust me, I'm nowhere near at the end yet, but, you know, I still have my days where, you know, you are facing those things. So just bear that in mind. In dentistry overall, there's lots and lots and lots of fields. You know, there is a myth out there where they think dentistry is very just in the mouth. Yes, you are in just the mouth, but even in that, there are subspecialities. So, you know, if you don't want to be a general practitioner, you know, you can go into restorative, or there's braces, there's implants, so the surgical side of things, working with children, oral medicine, so that's things like oncology and cancer and picking out other lesions in the mouth, oral health, working with special needs again, you know. So it's not just about teeth. It is a holistic, so there's a massive overlap between dentistry and medicine. You have to, you know, and there are subspecialities. So if one thing is putting you off about dentistry, that, oh, well, I'm just going to be looking in the mouth and it's just the teeth, yes, but even in that, there are many other things that you can, you know, go into if you wanted to. Entry requirements. I'm just going to touch base on this because, again, Manu has already touched base, and it's very, very similar to most medical schools. Again, things have changed over the years since I graduated, but as I know, GCSEs, you need to have lots and lots of top A stars and A's. A-levels, chemistry is the compulsory one that you have to have, and then another science, usually between maths, physics or biology, and then any other subject, really. Yes, there's a clinical aptitude test now to see, you know, are you actually going to be clinically, you can be very good academically, but actually will you be able to do things hands-on, and how are you with communication? And obviously you need to demonstrate some form of work experience that, you know, have an insight and a background knowledge about the profession, and obviously, like all others, there will be an interview process at the end. Touching base on work experience. Now, I know this is a current issue just because of the COVID. You know, so if some of you have already banked your work experience, brilliant. If some of you are on the verge and we're going to do it, and you know, don't worry about it, because obviously, you know, the universities will be aware that this has affected everybody and all the students. But I would encourage you, you know, and if you're a bit younger on and you know, you've still got a couple of years yet, so, you know, think about your work experience, dental practices, dental hospital, hospices, care homes, charity work. You know, it's not just about going to the dentist and writing about what you saw. You know, as all the students have really nicely touched today, it's about what you gain from it. It can be even your own experience, you know, it doesn't have to be, you know, when I was, you know, X amount, I went to the dentist and this is what I had to undergo and this is what taught me. So anything that you can bring together, that's what's important. But obviously, you know, if you can write to your dental practice, or, you know, if you can do voluntary and charity work, it's a must. I did it back then, all students are doing it now. You know, it just shows that you're ready to go the extra mile, that you're ready to help, because that's ultimately what dentistry is about as well. I just skipped a slide there. Right, so personal statement. Again, it's all very similar stuff that's already been mentioned. They are looking for attributes and skills. They are looking, why do you want to do dentistry? You know, what motivates you to want to do dentistry and not any other profession? You know, have an insight into your own strengths and weaknesses, you know, because constantly, especially in dentistry, it's not just about doing a filling. That filling will be different for every single patient. So, and you will change how you work after each patient. So they want to know, can you reflect? You know, are you able to put your hands up and say, aha, that I could have done better actually, and this is how I'm going to change my work ethics. They want to know your well-being and hobbies. So yes, absolutely, like medicine, they need to know that you can live life. You know, you can go out there and you can have a good time as well. That, you know, you can meet people and you can de-stress. That you can put yourself away from your work and do that. So that's very important. Manual dexterity is probably, obviously, without saying it, it's probably one of the most important things. If you're not good with your hands, if you're a bit clumsy and you don't like to get your fingers into things, and, you know, I don't know if dentistry will be for you. There will be something there.
Sorry, there was some background noise from someone. We can continue.
Okay, sorry, yeah, I'll just finish that slide. So yes, manual dexterity is the key one. So, you know, absolutely write about, like Manu says, you know, cake writing, piano, art, you know, anything. As boys, if you're into mechanics or Lego, you know, all these things, it just shows that, you know, because that's what you're going to be doing. You're going to be using your hands. So they want to see that you have a passion for doing that. You need to be having signs of effective communication and teamwork. You're going to be part in, you know, it's almost a little bit smaller team, you know, than medicine. So in that sense, you know, you're going to be spending 8 hours potentially with your nurse. You're going to have a practice manager. You're going to have, you know, so you need to be able to be a team player. You know, you need to be able to work with a team. That's very important. And obviously empathy and honesty, as with all caring and healthcare professions. The last thing I'm going to mention is just about the interview. Again, know your personal statement. It's one of the first things they pick up, you know, so they will know if you've made things up. You need to know it. So if you've written that you've had an experience somewhere, you know, know about it, be able to back it up. Do some background reading, so know the current topics in dentistry that might be flying around, know the role of the NHS, you know, you can pick up some journals as well, just have a little insight into, because they may want to know that, have you bothered to pick up something and actually read about it? And be able to link your work experience with your personal attributes, you know, so it's not enough just saying, well, I did a week at my dad's or mum's surgery or X, Y, and Z, and this is what I saw. They don't want to know that, because you're not a dentist. At this point, you're just a student who wants to be a dentist. So they just want to see you, and they want to see why it is that you want to commit yourself to a stressful profession. And obviously talk about your extracurricular activities in your interview. And most importantly, guys, just be yourself, you know. They'll ask you questions that you might not know the answer to. That's okay. Move on, try and, you know, be honest, be open, because they just want to see that, are you a person who can get yourself out of tricky situations and learn from it? So yes, that's the only thing I'm going to say. Just be yourself and you'll be absolutely fine. And yes, good luck.
Thank you so much, Wajia Bashir. If I heard this presentation 20 years ago, I would have been dentist today, I believe. Is there any chance I can enter now?
And me too, me too.
You know, I think the other way around. I want to be a surgeon. So I'm thinking, do I want to go to medic school now and do that again? So maybe not.
Surgeon's life is tough. We got our female surgeon, Dr. Sadabhai here. She can also highlight it later on how tough it is. Anyway, thank you so much. It's a very informative talk. And as I said, I would have changed my career if I heard before that. So now I would like to introduce one of our very respected senior member here, not senior, my colleague, Dr. Afzal Sawal. He is a pediatrician, and I would like him to say some words about his experience. He undertakes interviews for med students as well as junior doctors, and it's a whole book in himself. Afzal,
thank you very much, Naseem. Thank you. Thank you for such a good introduction. I just want to tell you about a couple of first 30 seconds about myself, because it's important that I'm the senior clinical lecturer at Birmingham Medical School, and also the tutor. And the personal tutorship programs I've been involved for the last many years. And I'm looking after third, fourth, and fifth year medical students in the Birmingham Medical School. And I'm the interview panels. Now, today we have a fantastic presentation from all the young medical students who have gone through this process. And this is the advice for all the other people who's in A-level listening for this thing. Now, interview is your last hurdle before you enter to the medical school. And I think the FISA, the last point was, be prepared and don't panic. I mean, that's the sum up of everything. You know, you've done your A-levels, you've done your UCAT, you've done your personal statement. Now the interview. Interview will decide whether you will going to enter in that medical school or not. Okay, so come very well prepared for the interview. Okay, some of the point from the Wajia, I took it when you need to show yourself. It's your personality should come out of the interview. Don't be timid and shy. You know, you come out what you learned from your work experience, what you did in your A-levels, extracurricular activity, what you learn. Don't say I'm a team player. Well, give me the example. What are the things you did in your in the A-level that show you that you are a very good team player? Okay, they throw you all sort of different questions about your team working, about your leadership, about your. It's a multi centers, many stations into in most of the medical school. But there's some of the questions are very tricky. Like ethical questions are always there. I don't know. Medical school love this ethical question of alcoholic and liver transplant. And this question comes again and again. So you need to get prepared for these ethical questions. So I think come for the interview very well prepared. This is the most important thing is, okay, so whatever you did, and whatever the statement you make in an interview, give the example from your experience. That's how you develop those sort of quality in yourself. Okay, your work experience will going to teach you about your communication skills. If you've done the Duke of Edinburgh, that will going to teach you about your working in a team and leadership skills. You did your A-level exam and preparation and so on and so forth. So So you have the huge amount of things, huge number of your personality you can talk about, and always learn about to talk about yourself. You sell yourself in the interview so that you come out very well very impressive from the interview. In the interview before, because these are only 4 options, 4 interview, you will be offered 4 interview, and out of the 4, 2, you have to get the 2 calls, because the thing is, it's quite competitive, because the medical school calls so many students, and then from those pool of the students, they pick up either 100 or 200 candidates. So become very prepared for the interview. This is my first advice. Those who are in the medical school, I like what Hassan did. Okay, intercalation is good. I always encourage to do the intercalation. And the third is, my point is, those who are in medical school, if you don't want to be a surgeon, be a pediatrician. You will enjoy to be pediatrics. I'm telling you, working with children is excellent. Boys, it's medicine is boys or girls. Medicine is a long haul stuff. You need to prepare to commit yourself for many things. Okay, one thing medicine has taught me, either as a boy, either in a couple of years your hair will be like Amir Bernie, or totally gray, or you will be like me. Okay, so that's medicine will going to give you at the end. So you need to fix yourself, committed yourself with everything. And I wish I would have listened to the Manur and Vajia about 20 years ago, and I would have been a dentist. Okay, so impressive. Well done, you 2 girls. Well done, well done, well done.
Thank you.
Well, thank you very much. And if any question, I'm happy to take it on. Thank you.
Thank you so much, Afzal Bhai. I just would like to announce something, that we have got 2 special guests from Ireland. They are studying in the Irish medical schools. We got Umar Muhammad Khan and Saad Muhammad Khan. They will be taking part in discussion in our question and answer sessions. And if somebody wants to have some more information, they can contact them. I would like now to introduce Sadaf Jafarbai, if she wants to say some words about her experience. Sadaf?
Thank you, Naseem. I'll just take a couple of minutes, and it's really to let especially the girls know here that surgery is an option. Don't get put off when you see many boys getting into surgery. It is a fantastic field, very much hands-on, like our colleague dentist has said here. It's a long training, but at the end of the day, it is very rewarding. And then you can always decide what you want to do. Do you want to be a full-time general surgeon? You want to be a part-time general surgeon? I'm a breast surgeon myself, so as you can imagine, most of my patients are females. It is very rewarding. You study medicine, then you go into surgery. It takes about 6-7 years till you qualify as a surgeon, but there is lots of help available. I know some women would get put off by saying it's a long training, but there is a lot of support available. There is a website for women in surgical training. You can go and have a look at it if that is something during your career in medicine or during medical school you want to pursue onto it. And through APNE or on an individual basis, there are a lot of surgeons available out there who would be happy to help you. But just really to say, all males are not surgeons and all surgeons are not males. So don't be put off with that.
Thank you so much, Sadaf. Before we go to the question and answer sessions, I would like Amir Bernie, President of APNE, to say some few words. And I've just been informed that my next patient is on table. So unfortunately, I have to excuse for next few minutes. And Amir Bernie will take over from here, and I'll definitely join. So my empty chair will be looking after you guys. Thank you.
Thank you, Naseem. You've been wonderful.
Thank you, Naseem.
Absolutely wonderful to have you as a moderator, Naseem. So thank you, everybody. I think we had a fantastic session where we had a number of presentations from medical students, newly qualified doctors, our esteemed dental surgeons, and Sadaf Jafarbai, Miss Sadaf Jafarbai, who is a surgeon. So some tremendous role models for you out there as well. For those who are in schools yet, you don't have to think of careers now, but you should start thinking of careers as well when you speak to a pediatrician or to a dental surgeon, or to a surgeon. You can see how diverse medicine is. And as medicine is hard work, but so are many other professions. Medicine, I'd say, is a lifestyle. That's the only thing I would say here, that we cannot shut our shops at 5 o'clock. We can take our patients with us, and it's a lifestyle, and everything else fits into it. But so many of us have done it. So many of us have done it before us, and I'm sure those who are listening in, our medical students, our students from across the UK and across the world actually, who aim to be medics for the future, they will also do it, inshallah ta'ala. So I'm very happy with the presentations. I think we've had some really good presentations, both medicine and dentistry. I think it's time to open up the question and answer session. So if anybody has questions, please type them into the chat box. Naseem Varaj has left obviously for his pressing operating list, but me and Dr. Tariq Razak and Afzal Sawal are here to look at your questions and to try and respond to them from our panelists. We also have our colleagues from Ireland, so they have an Irish experience, so they are studying in Ireland. So if anybody wants to talk about life in Ireland or how it might be for a medical student in Ireland, if you have any interest going to Ireland, please do. Okay, so I'm going to open up some questions, and then we can ask our students first. So Afzal Sawal, if it's okay if I go first, ask the questions, and then we can take some questions as we go along.
Yeah, a participant by name Umar has asked a question. Umar, he says, if you can't get the grades what you want for certain university, what can you do?
Okay, so would any of our medical students would like to go first? Hiba, if I can come to you first, would you like to answer that question?
Yes, so if you don't get the grades, usually in clearing, they allow you to get lower grades. So like some people are allowed to get in with AAB or ABB as well. So make sure you check clearing as well. But if you don't get B's as well, you could also do a BSc, so like biomed or biochemistry, and then apply for graduate medicine. And then if you don't want to do that, you can always go abroad and study in Europe as well, because they allow lower A-level grades.
Okay, I hope that answers that question. Would any of the other medical students would like to answer that question if I pick on? Nabaha, would you like to add to that question as well?
I feel like you can also take a gap year and redo your grades if you don't get it the first time. It depends on like how many grades you missed it by, but yeah, I think that's, yeah.
Thank you very much. I'm sure we'll have a similar question later.
Can I add
yes,
one
please,
point?
Please add.
I think there's the Hiba said one point, clearing in medicine is not very common. Okay, so don't, there is 1 or 2 medical schools do clearing last couple of years, but most of the time all the seats been filled up. So if you don't get grades, the second option is either take the gap year, or if you want to really don't want to gap year and want to do something, you need to go abroad. But you need to improve the grade.
Thank you. We have a question from Zainab, which is, if you don't take A-level math, does the third option have to be medicine related, for example, psychology? So can I ask Haris if you have any insight on that question first, and then we can take it further?
Yeah, so if you're doing a third A-level, it doesn't necessarily have to be science related. Most universities, they only really care about that you have chemistry as a main requirement and biology. A lot of people just naturally choose to do maths and physics alongside that because it's just similar to the other 2 subjects. But for your third subject, you can choose what you want to do. Just make sure it's an A-level that's considered a good A-level. So some A-levels, some universities may not classify as an A-level, such as critical skills and things like that. But an A-level like psychology is completely fine. In fact, I think it's quite a good A-level to do alongside chemistry and biology, especially for medicine. But yeah, just check your university requirements, and if they don't specify anything about a third A-level, then you should be fine.
Okay. Thank you very much for that question. We have another question from Niall Burney, which is, what backup courses do you recommend for medicine? I'm going to ask Zaina for that response first, and then take it to the panel. So Zaina, if you would like to answer that question first.
So I've seen a lot of people do like biochemistry and biomed because it's most related. I would say from talking to my two friends who do it, biochemistry tends to be a little bit better just because there is biochemistry modules within the course. So those people kind of already know it and know it in more detail. And for some people that can be a little bit more tricky. That tends to be the more extension from A-level biology and chemistry, but obviously a lot harder. Biomed tends to be the very simple areas of medicine. So you maybe do very, very basic anatomy and very basic other parts of modules, but it doesn't, from her experience anyway, it didn't provide that much of help compared to the person who did biochem. So I would probably say biochemistry would be the next best option.
I think also the question is about what backup courses you can do in terms of preparing for interviews. I think there's also some questions are being asked around preparing for interviews or preparing how to get to medical school. Are there any thoughts on those, Dana, as well?
So there are a couple of courses online. I can't remember which ones that
you don't have to name them. You can just direct them in the direction.
Yeah, I think they're okay. People tend to have mixed opinions on it. I think they're mostly general information on how to prepare for certain interviews or advice for the UCAT or BMAT. I think more of like, I think someone mentioned Medify to help with like entrance exams. I think more online ones tend to be better and more cost effective. But I think it's a personal one. If you want more support, it is there, but I think online options are probably a bit better.
May I ask Manur as well if she would like to advise students about preparatory courses for getting into dentistry, for example? Again, no names, if you can just give them general directions.
I think when it came to preparing for my dental interview, personally, I just used some, like little books that you can get sort of applying for dentistry, but it was very basic stuff that was covered in them. I did go on like a course for UCAT preparation because I had to, some of the universities I was applying to required the UCAT and I wasn't too familiar with it, which did help. I can't remember the name of it for the life of me. I know it was like 5 or 6 years ago, but I just can't remember the name, I'm sorry. But yeah, just I think I'd say not, I didn't find that it was compulsory to go into a interview prep course for dentistry, but that was just the experience that I had, if that helps.
Thank you very much. We have another question from Haja, which is, would you recommend EPQs? And if so, do you have any ideas what topics to do them on? Hassan, would you like to respond first and then we can ask other panelists?
Yeah, sure. So specifically regarding the EPQ question, I think it's one of those things where if you don't want to do it, don't do it. Universities are never going to say, oh yeah, we require an EPQ. But again, I applied 6-7 years ago now, so I would double check that. Because again, with a lot of these questions, I'd say it's great having the opinion of the panelists and myself as well, but I think just check with the unis. Some students I know will sort of say resit the year and then try to get those A2s, but again, you need to check with the uni if they can actually do that. From my experience at uni, just answering, the question about what degree to do, I know a lot of students that actually they tend to be some of the smartest students in the year are the graduates, because they've done their pharmacology sort of undergrad, they've done their biochem, they've done their biomed. And as med students, naturally, when you join uni for the first time, you kind of get that, oh, it's a rush of uni, you get that independence, you want to have fun. So naturally, people tend to do if I'm just being honest, people tend to not focus as much in their first 2 years of uni, which is completely understandable. But actually, if you go do an undergrad degree, you kind of get that out of your system and then you learn all the things that you need in that medical undergrad. When you go there, you're completely prepared. They know all the pharmacology, which you're then going to have to relearn. They know all the anatomy, which you're going to have to relearn. They know all the physiology, which you're going to have to learn. So I think it's I would, to be honest, recommend an undergrad. But again, if you prefer to only take 1 year out, take the year out, redo your A-levels, but just check with the uni what you're allowed to do. And again, it's the same with the EPQ. If you want to do one, I don't think it's going to do you any harm. And again, topics, EPQs are A-levels and the EPQs are very much tested on actually your ability to do one, time manage. So I don't think the topic is necessarily that important again, because it's actually demonstrating that you can do essays, you can research, and you can actually take that time out to do something that interests you. So I don't think there's a downside to doing one. but I also don't think there's a lot of positives unless it's something that you do really want to do. So a lot of these are just personal decisions.
Thank you. That's very insightful, actually, very, very informative. So thank you for that. We also have a comment from Harun, who's saying he's a fifth-year medic and that he was requested by Mr. Riaz to join the Q&A session. So thank you, Harun, for joining in. And regarding not meeting the grades, he has recommended that you can reapply the next year, having reset the A2s. And also you can check medical schools which accept results beforehand. So that's a comment from one of our participants. Okay, I have a question, private question, which I'm going to direct to my son who sat here with me, which is actually what do you do on the day? Because it's a very tense day for most of you to actually come to the interviews on the day. So how do you manage your stress, maybe 24 hours earlier, and also on the day, how do you keep your calm, your cool, your collective cool, and also respond to the interview? So I'm going to direct this to my son here. Aisha, would you like to inform our panels?
So I would say a lot of like keeping it cool is being prepared well for the interview. So don't take any interview lightly, and prepare for any interview as if it's your last interview or if it's your only interview, even if you have 4 lined up. You never know what's going to happen in any of those interviews. So just imagine in your mind that this is the one interview, this is the only uni that you're going to go to, this is the one that you definitely want to go to. Because even on the interview as well, you have to be genuine. So say in reality, you know that this university is your 3rd choice, and it's not necessarily the one that you want to go to the most. It's irrelevant because at the end of the day, it's all medicine, it's all dentistry, and they're all competitive courses. So I think preparing well will definitely help you keep you cool. And also on the day, I think don't really overthink it. Just try and get your personality to show through on the interview. Again, as I said earlier, don't be timid or shy. It's about being confident on the day, but don't be arrogant either. You actually are just applying to medical school. You're not actually a doctor yet or a medical student yet even. That's what I would say.
Okay, thank you. That's very, very useful. After Sawal, would you like to come in?
Thank you very much. That's some very useful tips. But one thing I must tell you one thing, if your interviews are quite far away from your home, please be there one day ahead of your interview, be rested and come, be on time in the morning. Okay, and while you're waiting for the interview, you know, stay to yourself, be very thoughtful, not to be chat around too much outside the interview rooms, so that by the time you go to the for the interview, you're feeling very exhausted and tired. So stay calm, stay collective. Have your breakfast in the morning. That's important. Don't come very hungry, especially the girls. Okay, don't faint in the exams or interview. Oh, even the boys. I'm saying girls. The girls are not fainters. The boys can faint also. Okay. So don't drop yourself in the before the interview. So have your breakfast, come there and well prepared, in your best dress, and the thing is very professional looking. Don't be very cocky. I mean, a very, very important point I should mention. Don't be very cocky. Just stay calm, stay very sober, stay yourself. I think these are the best thing for the interviews. And if at one station you didn't done very well, don't just come out and drop on the floor. So keep your energy going till your last stations. Okay, that's very important things to be on the interview day.
Extremely important. And I would actually echo those thoughts from Aisha and from Dr. Sawal there. I think what's very important is to keep your cool. Inside your heart is going at a million miles an hour, but outside you have to come across as you are cool and calm and responding. Always be polite. Always say hello and goodbyes and thank yous. Use the alcohol gel if you are interacting with the patient or if it's there for you to be used. Dress smartly. So it's all very important. It's not just what you are telling us, it's also how you come across as a personality. It's quite important. Okay, there is a question from Niall Burney again, as are you allowed to do an intercalated program at any time while you are at uni? So I'm going to ask Hassan to please respond to that question first.
Again, sorry, I know this must be frustrating for asking questions, but it differs between unis. So I know at UCL, they do, the way that works there is you do your sort of pre-clin first year, second year. They then let you then sort of have to do your intercalated after that, which is a really good time to do it because pre-clin's quite intense. That's where you've done all your science, your stuff anyway. And then after that, you just have the straight road of clinical medicine. But I also know it would differ at uni. So I think Imperial do it in their second year, I think. Barts do it a bit later. So it does differ. And then I know some unis, they actually just say you can choose when you want to do it. So it varies. It will also vary depending on the course, whether it's a straight run through or whether they do sort of pre-clin then clinical year, then pre-clin then clinical year. So again, just look into the unis. They're all different. But if I were to suggest the best time to do it, it would be before you hit your clinical years, because actually you don't necessarily want to forget a lot of the preclinical stuff. And then also after interrupting your clinical years, all clinical years are relevant to each other. So if I've just done all sort of general medicine this year and I'm doing specialties next year, I still need to apply all of my knowledge from this year to next year. So taking a break would actually be a bit of a pain. So that's the best time to do it. When you're allowed to do it, that will vary between unis.
Thank you so much. I have a question for our dental surgeon colleagues here, which is, can they intercalate in dentistry? Does that actually also happen in dental schools as well? So Manur and Vijaya Basir, if you would like to add to it.
Yeah, are you giving me to, yeah?
Yeah, Manur first and then Dr. Vijaya.
Yeah, of course. So I know it's not as common, but definitely at Leeds, they definitely gave you the opportunity to intercalate. And that took place between sort of, was it 3rd and 4th year? So students would then take a year out. At Leeds, I know that it was a bit restricted in what you could intercalate in. I think there was things like microbiology, I think anatomy, maybe public health. So there is an opportunity there. It's not widely taken on by dentists that I'm aware of, but you can intercalate if you want to. And I know a few people who did. So, yeah.
Thank you. Ms. Vijaya Basir, if you'd like to.
Yes, of course. So obviously things have changed since I graduated back from Manchester. That wasn't really, we used to have more of an elective year, you know. So I think Manur's right in saying that it may just be very, very, you know, certain universities that might offer that. But as my current knowledge is, it's not, tends to be the trend for dentistry, because it's 5 years clinical and they just generally, you know, and then you do whatever you want to do afterwards. So if that's something you're really interested in, I would probably just look around on specific universities. But as far as I'm aware, I don't think it's that much of an option, because you're already in a subspecialty, if you know what I mean. So, but again, things change. So please just look online.
Okay, thank you very much. I would like to request our Irish medical student friends, if they are still here with us, Umar and Saad, and tell us about life in Ireland as a medical student. So either one of you, if you could just unmute yourself and put yourself on camera and tell us. Some people are interested in learning about life as an Irish medical student, if you are here still. Okay, I don't think they have responded. If they are listening in, please do join us. We have a question from Zainab, which is to everyone. When should I start preparing for UCAT? 1 year before we set A-levels, leaving, I'm not sure what that means, leaving certificate. And then would you recommend to do both UCAT and BMAT? So I'm going to ask Haris first, and then we can take it to the panel.
So for the UCAT, I'd say you should start preparing about 6 weeks before your exam date. I believe you need to book it before October of your A-level year. So try and just book it at any time that's convenient for you. I wouldn't book it too early, but at the same time, I wouldn't book it too late, because if you can't make it, then and you booked in one of the last few days, then you can't really do anything about it. So I'd book it around September time. That's pretty much the time I booked mine, and I start preparing about 6 weeks beforehand. I'd say I'd take it a bit easy at the start for the first 1 or 2 weeks. Just try and get used to the questions, familiarize yourself, and then for the last 4 weeks, I'd practice the questions under strict time conditions. And in terms of doing the BMATs, the one issue with the BMAT is that you have to apply to universities first, and then you take the BMAT afterwards. So you don't know what score you'll have. But with the UCAT, you can actually, if you have a good score, you can use that to your strength and apply to universities that are that mainly focus on the UCAT. Or if you haven't done too well, you can maybe apply to more BMAT universities and take the BMAT instead. But I mean, the BMAT's only, I mean, I think it's only if you're interested in applying to Oxbridge or Imperial or UCL, then I'd probably recommend doing the BMAT. But I'd recommend not applying to more than 2 universities that require BMAT, because like I said, you get your results after that you apply to your universities. So it can be a bit risky if you apply to more than 2 BMAT universities, because you only have 4 options. So, you know, I'd weigh up the pros and cons and then just decide whether or not you want to do it.
Okay. Hiba, would you like to come in as well with some comments?
Yeah, so Haris said that you have to do the BMAT after you apply, but that they've actually changed that. You can actually do the BMAT before you apply now, 2 dates. So it's okay if you do the BMAT or the UCAT.
Okay, thank you for that. Nabha, would you have any comments? This is an important one because lots of students are in the midst of doing these things. So Nabha, I'll take comments from everybody in the panel. Nabha, please.
One thing from personal experience, I would do the UCAT before you go back to school, because when you go into year 13, the first term is really intense because you're applying and also learning new content. So doing the UCAT and having that like in the bag before you go back to school is like is something I'd recommend, because I didn't do that. Yeah.
And Fiza, would you have any comments, please, as well?
Yeah, I agree with what everyone said and what was just said about doing it before the school starts. So I did it like around the end of August, and I found that was like a good time. And in terms of like doing BMAT and UCAT, I think it just depends on what universities you want to apply to. So again, make sure that you've checked like the requirements online, and yeah, that's it.
Thank you very much. Asha, would you like to add anything to?
Yeah, so I'd say with the BMAT UCAT, like I said, like majority of unis, I think would take the UCAT over the BMAT. Like from the BMATs from Leeds and then a few London universities and Oxbridge, as I already mentioned. But there's also other things these universities look at other than these exams. So it's kind of about being like tactical in your approach to which unis you select. So I remember when I applied, I didn't actually apply to any BMAT universities. I never actually did the BMAT. I just did the UCAT because I saw what GCSEs I had, what A-levels I had, was predicted anyways. And the universities where I was applying to, the UCAT was the only one you needed. So I would just say just be tactical like in your approach about selecting universities as well.
I think that's a very important actually comment, because you have to act smart. So, okay.
Alice, you can say that you.
Yeah. Okay. So
it looks like there was a question from Salim that has that may not have been answered.
Yeah, yes, please.
Yeah, Salim asks, does optometry have a similar format as it's in the healthcare field?
I was coming to that question actually on my list, but I saw that optometry as a profession, yes, it's a fantastic profession. We know a lot of friends and colleagues who are working as optometrists. As I said, it's health related, is part of the allied professional fields as well. So I will leave this question open to the panel because I personally have no experience of it. If anybody wants to, please respond in the chat box, or they can raise their hand and we can. But personally, I would have no experience of it, to be honest.
Optometry is a really good profession, and I think there's quite a bit of demand for it. And especially the NHS, also the non-NHS organization, they can set up their own business. I don't know exactly. One friend of mine, her daughter went to the optometry, but I don't know exactly what the entry criteria is. But I don't think so that you require 3 A's or something like this, maybe 1 A or 2 B's or 3 B's, but it's a good course if somebody really interested in that particular area.
I think it's a very good course. It's a very good specialty, and as I said, I know a lot of people working in it. Maybe that's something as food for thought for our next career guidance webinar, or for people like 3Me themselves, if they're doing any further career guidance webinars, maybe they should include allied healthcare professionals. I'm thinking of pharmacology and pharmacy as well. They're very popular. They're very good courses. You can run your own businesses. So people who are business oriented, I think Dr. Bashir said earlier that you have a business acumen. You should think of dentistry as a profession because you're running your own practice.
Yes. I mean, I think we need to bring if there's a more webinar, we need to open it up other than medicine. You know, there are so many other professions the children can pick up, like the finance and accountancy and the lawyer and everything. I mean, they're tremendous, and we need some role model from them. And
yes,
who can
I'll
persuade
Dr.
people.
Tariq here, because Dr. Tariq actually has got a plan what they're doing in Manchester. But Dr. Tariq, please go ahead.
Yes, we are inshallah doing this on pharmacy. That is, we are put separately, because if we put on this one, it will go on too long. And particularly some people who are only interested in pharmacy will not be coming in this one. So we have definitely lined up pharmacy, and also we put as a allied health professionals, in which we are planned to include optometry as well. Biomedical sciences, being a scientist. So this is what we plan. And also we are doing on finance, accounting, law, how to become academic, and also we are including to become academic in the university. So it's a different fields we have selected, and also on the business side and finance. And the other thing is civil service. Our people, very few go to civil service, and you'll be surprised how the other minorities are in those, and our are lacking in civil service. So one of the talks will be on the civil service as well, inshallah.
Inshallah.
We are very hooked to the medicine and allied medicine, medical things. I think our children should think of out of the box, do something different, something else.
Absolutely.
Yeah, we totally agree. And I think Dr. Tariq Razak, we also must consider nursing and paramedics as options.
Yes.
Because we do need people from our communities, from Asian Pakistani community, to think of these professions as well. We also have a question. This is very clearly directed towards our dental surgeon colleagues. Is there anything different in the process for getting into dentistry schools compared to medical schools? So Manur first, and then Dr. Ms. Bashir.
So anything to put in the process? So again, I'd say it's very similar. So personal statement, work experience, volunteering, all that stuff that we've covered, I'd say it's very similar. I hope I'm getting the right end of the question here. And in terms of, then in terms of the interview, again, either multiple mini interview or traditional panel interview. So you have those two things, which I think are the same in medicine as well. They're the two types of interviews that you can get. So from my knowledge, I think it's all very similar. It's just obviously the course that you'll be applying to is different, but they're both healthcare based, as we've established. So very similar protocols, but that's my knowledge. I don't know if, would you want to add anything more?
Yeah, no, that's about right. I mean, I would say a very tiny component is focused on the manual side of things. So they may give you, in your interviews, they may throw in, something that's manual related, but the actual process in terms of grades, actually, just from my peers and even going back and from the young students, dentistry is very competitive. So you'll find that they're actually, if you've got B's, they just don't want to know you, and that's literally because there's so many little seats for dentistry. So I'm going to say it's more competitive to get into dentistry, but the process is the same. The attributes need to be the same. You're going to be working with people, you're going to be, it's hard work. So it's pretty much, the same.
Maybe also we have got some really good information about how dentistry applications work, how medicine applications work. I will actually ask once again for the benefit of our participants, if our two Irish medical friends are still in the participants, Saad, can they please unmute themselves and give us some insight into life as a medical student in Ireland? I know they had joined us earlier, but I'm not sure if they are still with us. And if you can hear us, Saad and Umar, please put something in the chat box for the benefit of our participants. Okay, so we don't have, okay, so we haven't got any comments from Saad and Umar, so I'll keep trying, so maybe at some point we'll get lucky and get them. And Rafiq has also shared an accounting webinar next week, so they're doing a career guidance on accounting, 3 memes, so please have a look at that event as well for those who are interested in accounting and finance. And I take the point from Dr. Tariq Razak that I think politics and civil service are a really important field. Not taking anything away from any profession, you choose what you choose, but I would definitely think violent politics. And I think we need to be a bigger, stronger force in the political world as well. So here we are. So there's one more question. I think it would be great if you get an idea about costs involved in what it comes out of the parents' pockets, and if there are loan scholarships available. So for those parents who are putting their kids through medical school, I think that's a painful question, but I think it's a very good question. So how do we take it? So shall we go with the Dr. Afzal, please? So can you just tell us your parent perspective, not a doctor's perspective, but as a parent, what is it to you in terms of cost? And then we'll ask the students.
I think it's variable, but it's a lot of cost. I think the first is the tuition fee. It's about £10,000 a year. On the top of it, you get surprises that I've been overdraft my credit card to such and such an amount, and when you're going to pay, and well, today is the last day. You need to pay by 12 o'clock. Fine, okay, fine. And I'm in the middle of doing something else, and I said once to him, how many overdraft? He said it's only £1,200. It only was important. So I mean, it's variable. It's different to different students, and so I mean, but the thing is, one thing I must tell you one thing. Before you go to the medical school, you need to know how to cook. This is such important skills. I mean, COVID-19 has taught me a lot of cooking. I start cooking now at this age, but you need to start cooking before you go medical school. I don't know. My son, even not a single day, I don't think he had ever cooked in his house, and I don't know how they've been living on these takeaways for years. So you need to know how to cook good, healthy food. That's cost effective. Don't buy food from these what are the Deliveroo and eat well, and these are so expensive, and you need to understand somebody is paying from somewhere. Okay, now one thing is you can take the loans. Your parents can ask for the loan from £10,000 from the government grant and £4,000 for your expenses of the year if they need to take it. But if not, then otherwise they are whole in your own the pocket of your parents. Okay, they are the big holes. Okay, so this is important thing is, but obviously you need to be more responsible. You need to know how to deal with your money. You need to know how to be not to expend too much and don't get too much overdraft. Be realistic in your expending, and try to cook at home, so that will be more cost effective for everybody. But yes, your parents can apply for the loans, and they can get 10,000 and 4,000 for your accommodation bit. It depends on where you go. If you go to London, it's very expensive there.
Yes.
Thank you, Asha. Would you like to add to that, please?
Just what I want to say as well is after the 4th year of study for medicine, at least, you can apply for NHS bursary as well. And for your final 2 years, so for my next year, which is my intercalated year, the year after, I have NHS bursary, which is going to be paying for, I think, the tuition coverage for those 2 years, but also they give you a £1,000 grant for the 2 years, which you don't actually have to pay back. So unlike student loans, you don't actually have to pay those back, which is quite good to know about.
Thank you. Manur, would you like to talk from the dental surgical perspective?
Yeah, so again, you get an NHS bursary in your final year of study as well. So similar to medicine. So your last year of study is funded by the NHS, and you get the £1,000, I think it's no means tested allowance. So again, like Asha just said, you don't need to pay that back. And again, tuition fees, £9,000 a year. I don't know if that was when I was at uni. I don't know if they've gone up or not. Maybe it's 10,000 now, I'm not too sure. And again, the loans are through Student Finance England, I believe, if you want to take out a student loan. And then I think when you start working, they have started taking out a bit of money from your monthly paycheck. So you basically think of student loans as being graduate tax, if you will.
That's it.
Can I ask Zana how you managing your money there in your first year?
So how do I manage? I think I have like a budget for the week of like how much I want to spend. So I cook myself. So most of the expense comes from food, and then it's travel as well. So I'm able to walk everywhere. You kind of learn to make compromises. A lot of people take bikes instead. So for our uni is quite good in terms of whenever we have hospital GP visits, they arrange transport for us. But yeah, if not, people find ways to save money, even if it's like where you shop, we'll go to Lidl or Aldi instead of the more expensive places. So it's just adjustments, but it's also keeping yourself accountable. Like, of course, there are times you spend more money, or like when Black Friday or Christmas sales come, you want to spend more, but you just got to be strict and honest with yourself. So evaluate, like every month, evaluate like how much you've been spending. You can say that.
Sure, true.
Okay.
Would you like to add so your experience about loans and scholarships, or anything else you would like to add to the conversation, please?
Yeah, so just a sort of like a general overview. I'm not sure how much you guys will know, because everyone sort of said they've all kind of covered it really, but the general overview is you'll have your tuition fees, which are £9,000 a year, and you'll get student finance for that. And then as was previously mentioned as well, for your final 2 years, the NHS cover that, so you don't actually have to pay for that. And then you'll also get your maintenance loans. This is basically to keep you going throughout the year. And depending on where you go, it varies. I know from my experience in London, it doesn't even cover half of your rent, to be honest. But then again, that is dependent on where you are, and it will also depend on your parents' income. Because if your parents' income is above or below certain thresholds, it will vary what you're allowed. And then again, depending on that as well, you'll get bursaries. So bursary is different to a loan. A bursary you don't have to pay back. So I know some people that will have the standard. So I have the standard student loan of 5,500, and then other students will have bursaries, and that can take them up to about 10,000, 11,000 a year. Regarding the other main cost you have is your rent. I know in London it varies so much. From, I think the cheapest I know someone paying is about 160 a week, and I know some friends that pay about 350 a week. The average is probably around 200, 210, depending on sort of how nice a place you want, how many people you live with. But then I also know friends that are in Liverpool, and they were paying about £60 a week. So it completely varies depending on where you are. And then on top of the rent, on top of you'll have the maintenance loan to help with that. You've also then got the bills, which is about £20 a week. And then you have your general costs. If you're obviously all going to go into freshers within the next couple of years, depending on what year you're at. And that's quite a big financial hit, because you want to be going to all these social events. You want to be, just getting involved, buying all the tickets for things which tend to be quite expensive. And you've kind of got to take that into account. But after the first term, it all sort of dies down a bit. And then it's just your general costs for feeding yourself throughout the week, getting any books or resources that you need. And then someone asked just quickly, how do you decide which city you wanted to study in? That then plays into it as well, depending on your costs. Because some people might instantly go, look, it's not feasible to go into London, so they're going to go somewhere else. But I think my advice would be pick the uni you want to go to first. Don't pick the city. Some people will go, look, I don't want to be in a city. I don't want to be in London. They want to go somewhere nice and quiet like Warwick. But I think look at the uni, look at the course, and then base it from there. But it's expensive.
Yeah, thank you for that. So now, Naba, how did you pick the city? Naba, how did you pick your university or city? Because it's an important question. I think you spend 4 to 5 years, maybe 6 years sometimes, in one city. That is a life transformation, isn't it, in a way? And you make lifelong friends. So how do you pick your cities? I'm going to ask all the students and then also ask Afzal Sawal later.
Well, I'm going to London, so I just wanted to go to like a city like that, and I really like London. And then, but I think it is about the university first though, and like I liked my university enough that like I didn't mind going to London, and like because it is really expensive, and it will, especially because like of travel and like the rent like we talked about. But yeah, I think it is, if you like the university enough, then the city normally comes with it. Like you normally just end up liking the city as well. But yeah, that's how I decided.
Manur, yourself?
Yes, so when it came to, in terms of cities and things, so I applied to cities that I liked. When I settled on Leeds, it was basically, I got 2 offers. I got one from Birmingham and one from Leeds. So sometimes your offers will dictate which city you end up in. Unfortunately, if you get one offer from one city, that's where you're going to be going. But again, I had the decision between 2, and I just based it off of the vibe that I got from the university on the day of the interview. And I just personally preferred Leeds. It has more going on in the city in my mind compared to Birmingham, sorry. But yeah, so I personally preferred the city. When I went there for the open day, I enjoyed it a lot more, and I was lucky enough to, alhamdulillah, get a offer from there. So I was happy with that. But like I said, just remember that your offers will sometimes inevitably decide where you will end up as well.
Indeed.
So choose wisely.
Fiza, I'll ask you this question as well. I think it's a very important question. Fiza, if you are still with us. If you are not, I'll ask Zaina. Zaina, how did you pick your city and why?
So I picked it, well, I think one, like people have said before, the uni comes first. So the course, for me, the course was pretty good. So that was kind of the main factor. But also how far it is from home. I know a lot of people want to just go really far and they don't care. So maybe phrase it more like how easy it is to get back home, because on holidays, whether you like it or not, you do have to go back home. So there are people, I know people who have to take a flight back home, or they're taking 4 or 5 hour trains. That wasn't really something I wanted to do. So yeah, how easy is also kind of like whether you want a more of a city busy area or a smaller place. Finances as well, like we said, London is more expensive. There are other places that are a lot cheaper. And then also quite a big one for me was kind of like the culture and the people there. I didn't want to be the only Asian person in the city. So kind of seeing, is there kind of people, or like, I guess people know what that means. I didn't want to be the only Asian person. So I wanted to see if I could integrate well there as well. So yeah.
Yes. I'll go to Vijaya. Vijaya, how did you pick your school I won't say many years ago, but you know.
Wow, listening to all the parents, because my kids are not at that stage. I've only got a 6-year-old and an 8-year-old. I think I was very nice to my parents, actually. So I was really lucky I got places in all the 4 places that I applied to, and it varied from Manchester, Leeds, Liverpool, and Newcastle. And I picked home. I picked Manchester. You know, didn't want to run away from my parents. But my best friend was here. I had that's where I grew up. So, and the course again, those were the 4 at that time. The best universities for dentistry. Newcastle had a super duper name in it. So, it was very north, but it's where I applied. But yes, I think university, but you have to think about these things, guys, because, apart from the financial side, there'll be days where you need to see your family, as hard as it sounds. There'll be moments where you need social support, you need friends, you need to have your laundry done, or you need a cooked meal, so these things do help. So think about all the dynamics of your family as well. When you're choosing, but also obviously the university is what I'm going to say.
Asha, how did you pick your city?
So I was also very fortunate to have 4 offers at the time. I think there were Liverpool, Sheffield, Newcastle, which is where I'm at now, and Hull York. And when I was picking my university, obviously, and the course is the most important thing. At the end of the day, you have to see whether you can cope with the course, the style of teaching. I quite liked the style of teaching at Newcastle, which is one of the main reasons why I went there. It was an integrated course. I quite liked the fact that there was quite early clinical experience, which is something that the university doesn't offer. And then on top of that, to be honest, I quite liked the independence of being a bit further away. Like, I wanted to see, because obviously you live in your house all day with your parents, and sometimes you can have quite a sheltered life. But I just wanted to see that if I could do it myself, and that's what I was trying to do, basically. But yeah, I think it's quite important to try and be independent as well, because like mentioned before, you do have to cook for yourself. One day, if you do live closer at home, or do laundry yourself, like trying to manage all of these things. And like I was talking about earlier, medicine is demanding, and is like a demanding career choice. And of course, there will be times where you need your friends and family. But also at the same time, like being able to do all of your social life, cope with all of that, keeping on top of all of your bills yourself, keeping on top of like all of your cooking, your planning, your week. I think that's quite an important aspect of university life as well.
Indeed. Well, thank you for that, Asha. And I think somebody said earlier, pick the course and then pick the city. That's some very good advice, actually. Pick what you think is best suited for you and then work from there. Because there's so many options in terms of courses and how you prepare for them. Medical schools, they're all fantastic schools. You can't take anything from any medical school. They're all just brilliant schools. The cities, personal choice, personal preferential choices are there. But I think pick the course, and if it's suited for you, then just go with it. Okay, I think finally we have Saad Khan from Ireland who just said, "Here we are." He's in the chat box. So Saad, we welcome you. And Saad, I would like you to please unmute yourself and give us some Irish perspective as a medical student in Ireland. Saad, if you can hear us, unmute yourself. Rafiq, if you can help us unmute.
Sorry, I was on mute. I was on mute there.
Yeah, Saad. So hello and welcome, and please go ahead. Tell us about Ireland.
Hi. So I'm a medical student in Ireland. I'm currently going to Trinity College, and I completed my first year. And so for the first year in Ireland, it was quite easy. We just learned the basics, doing biochemistry, physiology, anatomy, and such. It was a really good course. Medicine is a very difficult course to get into. I know that's pretty much always the case everywhere. We had to do an extra exam called the HPAT alongside the leaving certificate, which is the normal school exam that you have to do before you go into university. And so throughout my first year, you know, I made new friends, people from all over Ireland and even different countries like Canada and such were also in the course. It was a nice new experience.
Fantastic. And did you consider coming to the UK, or was it because of your family is and you like Ireland? It's a lovely country. I just simply love Ireland. But what were the reasons for you to stay in Ireland and not think of other countries as well?
Oh, well, I actually did apply to do the UCAT in order to get admission into the UK, although my first preference was to stay in Ireland because I felt it would be a bit more easy and a bit more comfortable for me. Sadly, it didn't really work out. I didn't really do that well on the UCAT. But yeah, I know that the options were definitely there to go to the UK. I looked at a few universities like Manchester and, you know, UCL, Cambridge and stuff like that, although they would also require you to do a BMAT exam.
Indeed. Thank you for that. Umar Khan has also joined us. Umar Khan is also from Ireland. And Umar, would you like to please give us some of your comments and your experiences?
Yeah, sure. So I'm currently going into 5th year in a 5-year course. I'm studying medicine in Trinity College Dublin, and that's one of the 5 universities that offer undergraduate medicine in Ireland here. So I guess just to go over that, if people aren't familiar, we have Trinity College Dublin, and then there's UCD and RCSI. Those are both in Dublin as well. And then we also have Cork and Galway that offer medicine here. And like Saad was saying, so for the system here, our end of school exam is called the Leaving Cert, and along with that you have to do the HPAT. So I know that you can do the HPAT from abroad, and they'll calculate the points with that as well, with your own school exams if people were thinking of applying here. And my experience in Trinity has been quite good. It's quite an old college, and it's really right in the middle of the city centre in Dublin. So it's very handy having lots of stuff around, and I chose it because it was nice enough for me to travel there. Yeah, and anything else that do you think people would like to know? Or
yeah, I'm sure that if people would like to ask any more questions about studying abroad, especially Ireland, they can write in the chat box. And if you're happy sharing your emails or further information, we are more than happy to share it further. So it's down to you, Umar and Saad, if you're happy sharing your emails with people who would like to know.
Yeah, sure. I'll send that in now. If anyone has any questions, they can send them to me. I know one of my friends, she lives up north here in Belfast, and she applied as well. So you can do that if you want from the UK.
Thank you, Umar, and thank you, Saad. And it's wonderful to have you join us from Dublin. We thank you for your time. We have a question from Amina, who's asking what's the scope if you do technical health sciences and, for example, assistance to physicians. And I know there are PA courses, so I think if you get in touch with the universities are doing physician associate courses. That is something, again, it's a 2-3-year course. I'm not sure about the specifics, but definitely a 2-year course from one of the universities I work at, and you can be a physician associate as well. So that's another option opening up for many of our students out there. So think of those. Harun would like to add, when deciding where to go to uni, remember your placement sites in year 3 might be far away. They go to York, but the places might be in Hull, Scarborough, and Grimsby. That's absolutely a very, very important point. I think start to learn to drive early if you can. That is something which, in hindsight, I say kids, my son and daughters all learn. They two are learning now, and one learn much later. So even if you don't drive, start to learn to drive, and that's a very important thing to have in your kitty of skills when you are in your 4th and final year, because you might have to drive or carpool share with your colleagues. Okay, I think we have responded to all of those questions, and we can move further towards now maybe wrapping up the session. It's been absolutely brilliant. If can everybody mute their mics, those who are not talking.
I just want to take some opportunity to thank Threememe. Sorry. I just want to take opportunity to thank Threememe and Dr. Razak for organizing and helping us with this webinar. Thank you so much, and I think it's well perceived throughout, and I'm already hearing via messages from different people. So thank you so much, and well done, guys, whoever has presented it, and it's very, very helpful for all those people who are looking for following your footsteps.
I think there's one last question we'll take, and this is from Dr. S.A. to everyone. Do universities have identical education in Ireland? Are they recognized in Canada and in the US? So I presume the answer would be yes. Saad or Romer, would you like to add anything to it? Because it's about studying in Ireland and going to Canada or America. You can chat in the, oh, you meant dental studies. So Manur and Vajia, if you look at the chat box.
As far as I'm concerned, I think yes, that's fine because it's still as a United Kingdom. But you have to bear in mind places like Canada and US have their own entry exams, regardless of whether it's you know, you could have an England-based degree, so from Manchester or anywhere else. But getting for dentistry, even UAE, I think it's only places like Australia and New Zealand. Where it's the higher majesty kind of countries that are related to the UK that you don't have to do an entry. But for UK, for Canada, anywhere else, unfortunately, you have to do their own dental training entry exams, regardless.
Thank you. And I think we've had some, I can see Naseem is actually now getting ready for surgery. So you have a real life experience of a surgeon actually getting prepared for his surgical procedure. That's a first.
I'm just trying to turn off the video, sorry.
So if you can, but thank you, Naseem, for all your help. I really appreciate it.
Yeah, absolutely.
Thank you so much. Thanks, everyone.
Thank you, Naseem, for your time. I really appreciate it. Dr. Tariq, I think we've exhausted all the questions. Once again, if there are any questions, we can go into the chat box and we can reply to them later. I would like to first thank everybody, then hand over back to Dr. Tariq. So if before I